Hi, I'm Noopur Desai, an oncologist at the Cancer Vet. So today we are going to talk about osteosarcoma in dogs. Now, osteosarcoma is basically cancer of the bones. As the name suggests, it can happen anywhere in the body, wherever bones are present. So you can see osteosarcoma of the limbs, of the jaw, the ribs, the pelvis, vertebrae. Saying that, most commonly what we see in dogs is osteosarcoma of the long bones. So these are called as appendicular osteosarcomas, which typically happens in their forelimbs or their hind limbs. Usually what we also see is this is a disease of middle-aged to older dogs. So dogs about 7 years of age are commonly affected by the disease. But in a few really young dogs as well, as young as 6 months to up to 2 years, this disease is seen too. So just like lymphoma, where we discussed that this can be seen in younger patients as well, osteosarcoma is another tumor which can be seen in younger patients. Now, typically the breeds associated are again bigger dogs. So in India, we would see them in Great Danes, Rottweilers, Labrador Retrievers, German Shepherds. These would be the breeds where we would normally see them. We do, of course, sometimes see it in smaller breeds as well, but this is more typically a disease of mid-sized to larger breeds. Many times patients come in saying, okay, look, you know what, he was out running and then must have hit something and now he's limping. Or she was playing with her siblings and she hit the table and then she started limping. So a lot of times they come in with this history of some sort of trauma. It's a little difficult to figure out if it is because truly of the trauma or the osteosarcoma. So for the referring veterinarians, in case the limping is not resolved with pain medications, I would highly recommend getting x-rays done immediately. Or if it is a breed that is older and you see an obvious swelling in the limb region, please get radiographs done as soon as possible. When a patient is presented to us, again, the first thing we would do is do x-rays of the limbs, see what they're looking at. Typically we see this lot of lysis, so breakage of the bone and new bone formation on the x-rays. There are two differentials for these lesions really. One would be an osteosarcoma or some sort of sarcoma of the bone, or it could be some sort of an infection, like either a fungal or a bacterial infection of the bone. So if you're living in an area that is dry and you can see a lot of fungals, I think it's worthwhile also keeping fungal disease in mind. So after we do x-rays, and if the bone looks like this could be a cancerous lesion, then the next step is to take a sample of it. So we would either do a fine needle aspirate or a bone biopsy called as the Jamshidi biopsy to get a diagnosis. At the same time, we would also want to do chest x-rays because osteosarcoma is a disease that very commonly spreads to the lungs. So we would always do chest x-rays to ensure that it's not spread anywhere else in the body, and just routinely either do abdominal sonographies too. In some cases, CT scans can also be done to evaluate if there's any lung spread, or also if they spread to other bones. Now, it's very rare for osteosarcomas to go to other bones in the body. We've certainly seen that happen. If finances is not a concern, a CT scan would be a better modality to look at if there's any spread anywhere else in the body. Then let's talk about the treatment aspect of things. Osteosarcoma lesions are very, very painful. So if we are suspecting osteosarcoma, we start them on pain medications right away. We start them on a non-steroidal anti-inflammatory drug, as well as maybe put in gabapentin or some other pain medication too. While we are dealing with osteosarcoma, there are two aims really for us. One is to take care of the local disease, to take care of the pain essentially. And the other one is to prolong the metastatic potential, which means to elongate how rapidly, or to elongate the time frame when this cancer can spread to the lungs. Osteosarcoma are very, very highly metastatic. So even before, if you've done x-rays and we've not seen any metastasis present, in 90% of the dogs, there's micrometastasis present, which means that these cancer cells are already present in the blood, which will eventually spread to the lungs. So our aim is, one, taking care of the pain. And there are two ways we can take care of the pain. One being an amputation. And I know when we first talk about amputation, the first reaction that pet parents have is, no, we cannot put our pet through that. What I can tell you is most dogs do really well with amputation as well. That leg is so painful that most of them, after surgical removal of the painful leg, are running around the next day itself. They're so much happier, they do so much better. But before recommending amputation, we would always do a complete neurological exam to ensure that they can actually walk on 3 legs, as well as a really good orthopedic exam as well. If we are in the clear, then amputation would be the first treatment option to take away the pain. The other local treatment would be radiation therapy. Now, there are 2 ways that we can radiate. One being stereotactic radiation, which is when we give really high energy beams to the actual cancer on the limb. And with that, there's pretty good pain control as well. But the criteria for selection of these patients are quite stringent. You don't want to do stereotactic radiation for tumors that are very big. They have a huge soft tissue component which have eaten away majority of the bone as such. So smaller tumors is where stereotactic radiation would be appropriate. And why that's the case is because after radiation, there may be a chance of fracture. So to minimize the chances of fracture, we would want to select our cases appropriately. Then the other form of radiation is palliative radiation, which is when it's either done once a week or it's done back to back, about 2 treatments. With that also, the pain control is pretty good. I mean, about 85% of the dogs are quite controlled for pain. So these are the local treatments. Then coming to the systemic treatments. Now this is to prolong how long it takes for these disease to spread to the lungs. Chemotherapy is the option. If we don't do chemotherapy, if we only do amputation without chemotherapy, the average survival is about 4 to 6 months. If we amputate and do chemotherapy, then the average survival can be about 10 months to a year. With stereotactic radiation and chemotherapy together, also we are looking at about 10 months to a year as an average survival. Sometimes because the bones are so fragile, if we've decided not to go forward with amputation, in that case, we also recommend adding in a bisphosphonate. Now, these are drugs that are given for, say, osteoporosis in women, and they help to strengthen the bones. It can be given once a month along with the chemotherapy, along with radiation, to minimize the chances of fracture. They do have some pain control properties as well. So talking about treatment for osteosarcoma of the limbs, we are trying to basically address the local disease. If amputation is an option, amputation. If not, radiation. Then we are talking about pain control. If we've not chosen amputation, in that case, radiation therapy and adding in zoledronate would be a good option. As far as systemic disease goes, we are talking about chemotherapy. There's a lot of research again going on about checkpoint inhibitors or immunotherapy for osteosarcomas as well. These are known to be highly immunogenic tumors. So basically we can take help of the immune system to help kill the cancer cells. So again, hopefully we'll have something soon as far as the immunotherapy goes too. And if you've decided not to do any aggressive treatments, if you've decided not to do any palliative radiation or any kind of amputation or chemotherapy, we can always keep them comfortable with pain medications. So please don't let them suffer. Give them pain medications. We have to consider their quality of life as well. So while osteosarcoma is the most common bone tumor in dogs, they can certainly get other types of tumors. They can get chondrosarcomas, fibrosarcomas, or metastatic bone lesions as well, which means if there's a primary cancer present somewhere else, that can spread to the bones as well. All right, thank you for joining us, and we'll see you next time where we'll talk about mast cell tumors in dogs.